Good morning, Mr. Cabello. How are you?
I'm doing well, thank you.
Glad to hear that. I understand that you were recently diagnosed with rheumatoid arthritis and your provider prescribed you methotrexate. My job here today is to give you more information about that medication. Is that all right with you?
Yes, that's all right.
Great. So to begin, methotrexate is an immunosuppressant drug. As the name suggests, it suppresses the activity of the immune system. Some common side effects include nausea and vomiting, hair thinning or hair loss, and mouth ulcers. Some more serious side effects include bone marrow suppression and liver irritation. With the bone marrow suppression, your body may have a harder time producing red blood cells, white blood cells, and platelets, which leave you more susceptible to infection and less able to fight them off. If you have an active infection or you suspect that you have one, please contact your provider. The liver irritation is rare and is a concern for patients who are at high risk of liver disease. If you start developing symptoms like abdominal pain, dark urine, and yellowing of the skin and the eyes, again, please contact your provider immediately. Additionally, allow me to ask, are you currently trying to conceive or do you plan to in the future?
No, not right now, but in a few years, yes. Why?
Good question. For both men and women, taking this medication can lead to birth defects. For now, be very careful about always using some form of contraceptive. In the future, contact your provider so you can discuss modifying your treatment plan before you start trying to have any children. Okay, I know that was a lot, but can you try telling me some of the more important points we went over?
Yeah, sure. I might get sick more easily and it might make some infections worse. I should look out for signs like abdominal pain, dark urine, and yellowing of the skin and eyes. If I think I have an infection, I should call my doctor. And finally, I should be careful about using contraceptives and talk with my doctor before I try to have children.
Perfect, you got everything right. Now let's talk about how to take methotrexate. So you'll start with a dose of 7.5 milligrams per week. So you're going to be taking 3 tablets 1 day of each week. You can take them with or without food. If you miss a dose, but you're still within 2 days of when you were supposed to take it, take the dose as normal. But if you miss the dose by 3 days or more, skip the dose entirely and don't double dose the next time. Um, just to check in, can you tell me how you'll take your medication?
Yeah, sure. I'm going to take 3 tablets once per week. And if I miss a dose by less than 2 days, I can still take the dose. But if I miss it by more than three, I skip the dose.
Excellent. Now let's talk about the do's and the don'ts of methotrexate. Let's start with the don'ts. The first thing you want to avoid is taking live vaccines. Whenever you need to take a vaccine, call your provider to ask if it's safe for you to take it. Another thing you want to avoid is taking NSAIDs. These can potentially increase the risk of developing methotrexate toxicity, which results from accumulation of too much methotrexate in the body. You will also want to avoid alcohol. Earlier, I had said that methotrexate can cause liver irritation, and drinking too much alcohol can predispose you to liver damage. Now let's talk about the do's. First up is regular blood work, usually every 1 to 3 months. This is to check your liver and your blood cells. Branching off of this, if you notice that you feel too much pain too frequently, call your provider so that you can discuss upping the dose or adding on an additional medication. All right, one last check-in with you. Can you repeat me some of the things that you want to avoid and some things you want to do?
Sure. So I'm going to avoid live vaccines, NSAIDs, and alcohol. And I need to do regular blood work and call my doctor if I'm experiencing too much pain.
That's right. And with that, we have gone over everything we needed to. Are there any questions I can answer for you?
No, I think I got everything.
All right, then. Well, feel free to call the office of the number of the provider if you need any help. Have a wonderful day.
Thank you. You as well. Perfect. You're good.